Go.
Well, certainly everyone's well aware of the demographics in Prince Edward Island. Certainly is changing. Our population is aging. We've shown that we're the government that's going to deal with those issues. We've increased our overall spending on seniors. We've dedicated a department to seniors. We split up the department. It used to be the Department of Health and Seniors. We've dedicated a full department now to seniors and community services. We're replacing our aging manors, which we're in much need of, bad state of disrepair, and we're replacing them, especially the one here in Albert, and I'm especially proud of it. It certainly gives our residents some dignity now. They have their own room with their own washroom in the new facility. We're putting a major emphasis on home care services for seniors. We've increased the funding that we give to home care services, and we've pledged to increase that by even more. We've covered more drugs. There's 120 more drugs covered now under the provincial drug plan than were covered when we took office in 2007. We're also our main focus is to keep seniors in their homes as long as possible with the help and support of family and community. And that's why we reintroduced the Emergency Home Repair Program for seniors. It's a program that will pay half up to $3,000 for any type of home emergency repair program. We reinstated that when we got into power. And when we, one of our campaign pledges for seniors this time is we're introducing a $5,000 grant that will help keep seniors in their homes longer. And we've also introduced the paramedic program up in Tignish, the pilot program where the paramedic will go and review people's drugs and seniors' drugs and that sort of thing. So I think we've made some major steps towards our seniors, and we're certainly going to, that certainly is one of our primary focuses as a government. We know how important these people are, that they've worked hard, they give us what we have here today, and we certainly respect that, and we want to make their golden years as enjoyable as possible.
Aging population on PEI, especially in my area right here, is we see it firsthand. To me, first of all, I think our main goal here is to keep our Western Hospital open, because that's one of the reasons why the people have come to Alberton, is because of the simple reason is the Western Hospital. And this government here that's in power as we speak, they're not saying they're planning on closing the Western Hospital, but the writing is right on the wall. Mightn't close it fully, but I can guarantee you the Western Hospital's in trouble. And if you go talk to any of the healthcare professionals, first thing I will do is make sure that we go to bat for anybody that, especially anybody that's in my district, anybody in PEI as far as that goes. Western Hospital is a big thing here. There's probably 225 apartment buildings in the town of Alberton, and that's one of the main, 90% of them are seniors. And that's, like I said, that's why they come here. But the hospital is the big issue, starts from there. We will work with the seniors very closely, because I deal with seniors on a daily basis on my bus tours. And for anybody that knows me, knows what I stand for. And I will definitely go to bat for anybody on PEI that I think that's. And first of all, we got to go back into the government and see what's going on. And it all goes back to our financial situations, but we will be working very closely with the seniors. And our hospital is a main priority, among a lot of other things.
Go.
Aging population in rural PEI, I think if the government had more in-home programs, more services for people who are taking care of their elderly parents, that would be good for PEI. Aging population, they're building new manors in Prince Edward Island, so that's a good thing for the island, and maybe add more rooms to the new places that they're building for the aging population.
Go.
We do have a rural population that is aging, certainly, and across Prince Edward Island we see that, but in the rural areas we find that, and in my riding, quite a bit of aging population. we have to deal with that in areas where we service and make sure that the aging population have the services and the abilities to survive in rural PEI. I've heard from the doors that we need to get the seniors' pensions up. They're having a hard time to make a living, and that's understandable. We have to give them the services and the ability to stay in their homes longer, and I think we're doing that with our senior strategies across Prince Edward Island. We're increasing our drug programs and drug plans for seniors. We've put in we've brought in the Seniors Home Repair Program, which is a great program, and there's a lot of uptake on it. We're increasing that, and we're also putting in up to $5,000 for seniors to make the changes they need to stay in their own homes. So anything we can do in the area of drug costs, ambulance coverage, and seniors home care programs to make seniors able to stay in their homes longer is one of the functions that we're certainly going to work on. And I think seniors are very comfortable staying in their homes longer now, and you see that a lot, and anything we can do as a government to continue that, we will certainly work towards that.
Go.
From going door to door, the main concern with our island seniors is the cost of living is making it increasingly difficult for them to remain in their own homes. The PEC government has committed to giving islanders volunteer tax credit for seniors, to reducing the PST, to making diabetic strips available to all, to a 50% cost share drug program, for a rebate for home heating fuel.
Go.
With an island party government, what we're going to be looking at in terms of the senior aging population is making sure that the HST is not implemented, because with their limited income, that would add on average $500 extra each year for every island, including the senior population.
2, 3, go.
The riding I represent, O'Leary-Inverness, probably has some of the more experienced citizens of our province residing within it, and those individuals have basically limited incomes, just pension incomes in most cases, and they're really struggling with trying to maintain the household and the service that they're used to expecting. And we, as a government, have implemented a number of programs. Number one, we've done the Seniors Home Repair Program, and in fact we're planning on enhancing that a little bit to allow seniors to reside in their own home and do the general upkeep and maintenance that will allow them to stay there longer. Recently we've just awarded a contract to a local company to construct 6 low-income senior housing units here in O'Leary and Stewart Lane, probably for the first time that's ever happened since probably the 1980s. And we were trying to provide as many of our extended care services and health care here in O'Leary with the expansion of the 15 units that are going to go into Margaret Stewart Ellis Wing, and to try to provide some of our medical services right here in the community. So those are all enhancements that will allow an aging population here in O'Leary-Inverness to access those services in a reasonable manner. But ultimately the trends are continuing with an older population in rural Prince Edward Island, and as a government we have to be mindful of that and try to create some economic opportunities here in our community where the children of those aging parents or their grandchildren are still allowed to reside in a community and still provide the supports to their aging parents or grandparents. And if we as a government can do that, although a big challenge it will be, I'm sure that will be the biggest thing that will enhance our population of aging residents.
Go.
For the aging population, I think we need to keep seniors in their homes as long as we can. They're comfortable there. If we have to have people going around for a few hours a week to meet the needs of our seniors, but seniors seem like they want to stay in their own homes. I fully support manners in that way, but like I have, my grandparents are fairly old and they're comfortable in their own home, and like they seem to be healthier when they're, around their family all the time.
Our seniors are one of our primary focuses of our government in the past, And going forward, our commitment is to provide more home care services so people can remain in their homes as long as they wish to. In addition to that, we are building more facilities and improving our manners that people live in, and more community care beds in conjunction with other communities to provide the necessary supports through as well as the palliative care beds that we've made a commitment to. So all in all, though, and our seniors home repair program has been a great program we reinstated in 2007. It's been utilized by our seniors and has been a great addition to the support for seniors to still remain in their homes, because that's ultimately where they want to be.
2, 3, go.
Cindy, your question, how will you deal with the aging population issue in rural PEI? Part of our platform is affordable housing for seniors. Also at the door, I've had great reception to the home heating oil for seniors rebate that live in their own home. Also a great reception for our tax rebate for seniors when they volunteer in nonprofit organizations, churches, athletic groups, any nonprofit organization.